All right, Mr. Michael. Now that we've gotten your blood pressure controlled and down a good bit, I want to go ahead and discuss the treatment plan for you. So I want to recommend some lifestyle modifications. And this can be pretty tough for you. I know. Healthy diet, walking. I recommend exercising about 30 minutes a day, 5 times a week. Does that sound pretty doable?
Yeah, I think so.
And I know smoking can be pretty tough to quit. That's why I recommend doing maybe 1 cigarette per week. Cut out 1 cigarette. Is that pretty good?
Try that.
All right. Well, hopefully that goes well. If it doesn't, we can kind of look at some further treatments for that as well. And I did find some medications to fit in your $50 budget after leftover. So for diabetes, I have 2 medications, glipizide and metformin twice a day, hypertension and amlodipine lisinopril once a day, and high cholesterol atorvastatin once a day. And since you're at a risk for cardiovascular disease, like we discussed earlier in the visit, I recommend aspirin 81 milligrams once a day as well. And here's all that information with all that medication and dosages. Let's see here. I also want to make some referrals for you. That being a social worker to help you financially and get back on your feet. Diabetes educator / dietitian as well. And a dentist and ophthalmologist. And I'll be looking at your feet on checkups with me. If I notice any abnormalities or anything starting to go on down there, any ulcerations, I'll probably refer you to a podiatrist as well. I know your work schedule can be pretty tough with fitting that in. What's your hours like currently?
Just kind of Monday through Friday, 9 to 5.
Might be able to get you in an afternoon visit, or I guess, would you be able to take off any days, or?
If it's raining now, I probably can as a farmer.
Okay.
So.
Well, we'll check the weather on that, because I really want to get you into see these people. And here's all their information as well. Pretty as soon as possible. So we'll just keep updated with the weather on that, and we'll see if we can get you in. You have any questions for me before we?
I don't think so. No.
All right. Well, I'll have the nurse come back in here and emphasize a couple more things, and then she'll provide you with some more information further. And obviously, you know where to find us.
All right. Thank you.
Yep. All right. Let's get this meeting over with. Mr. Michael, I sent you all the referral information, so I should have it. Let's hear it from Dr. Chuck first.
Okay, so yeah, I think he came by. I mean, his pills are gone at least, so somebody got his meds. We've been pretty busy here, so I haven't been really paying too much attention to all the patients or talking to them. I've just been giving out meds, so that's pretty much it on my end.
So did he got his meds?
Yeah, I think so. They're not here, so.
All right. Dr. Rose.
Hey, what's up? Dr. Rose here. I'm a MD, ophthalmologist, dentist as well. I'm in the OR. What do y'all need today?
Just following up on patient Michael. Sent your referral information not too long ago. Just kind of seeing what your plan is with that.
I see. I'm not sure why a dentist or ophthalmologist needs to see a diabetic, but yeah, I'll check him out.
All right. Well, that doesn't sound very thorough. We'll go with Alexis.
All right. Well, yeah, I haven't seen him yet, but when he comes, I guess we'll talk about, I guess kind of how diabetes works a little bit, and guess just encourage him to change his diet. I don't know. We'll see how that goes. And it's probably going to be really difficult, but we'll kind of work through it maybe. Yeah. Just don't really have much of a game plan there.
I mean, do you think he should even see you in the first place. I feel like I could probably just tell him, like, you know, good diet and diabetes education. Obviously, I've kind of already given him that much earlier in his visit.
You know what? That's a good point. I mean, honestly, you're gonna tell him most of what I was gonna tell him. If that, you know, you could cut out another visit. So maybe that'll work. Yeah, let me know. I'll be here if you need it.
All right. And Alyssa, you find anything over there for him?
Yeah, I haven't seen him yet. I've called him. He's going to come in sometime, I think, next week. We're going to talk about his life and his relationships and get him involved with church or other community services, you know, the gist, government services, whatever he wants to do. And then I'll let you know.
All right. Anything else before we close this meeting? All right. Peace. All right, hey guys, I guess we'll go ahead and get this meeting started. So patient Michael S., 54-year-old male, just recently diagnosed with hypertension, diabetes type 2, hyperlipidemia, tobacco dependence, and obesity. I'll be monitoring monthly until it's controlled, until we get his labs down, and I'll be checking those routinely. So I guess we'll start with the plan. So Dr. Chuck, so the patient come and get his meds today?
Yeah, he stopped by today and got his meds. One thing is just a little concerned about the cost, but he was within budget and everything, so that was good there. We talked about common side effects with his medications. The only thing I really looked into that might be concerned with you would be with the glipizide, so the sulfonylurea. A potential side effect of that would be weight gain, and he's already obese. Did you talk to him about diet and exercise any?
Yeah, we did discuss that, and I'll be monitoring his weight changes routinely through his follow-ups. And, just kind of being limited with his current budget of $50 to get on 6 meds. It's just kind of it's frustrating, but you got to do what you got to do. Is that all from you?
Yeah, from there that was all. So yeah, thank you.
Dr. Rose.
All right, so Michael hasn't come in yet, but when he does, since I am a dentist ophthalmologist combination, I'll do the annual routine. I'll get his baseline. I'll plan on seeing him once a year for both of those, and I'll send you if there's anything wrong, or I'll send you his baseline findings that I find. So.
All right, thank you. Miss Alexis.
All right, yeah, so I also haven't seen him yet, but my plan is just to kind of go over the ABCs of diabetes control. I'm just kind of explain to him a little bit more about like how it works and kind of understand the disease severity a little bit. Just kind of build on what you guys have already talked about with diet and exercise. Probably build on that with talking about meal planning, kind of portion control, and as well as maybe shopping with suggestions or something like that, to kind of help him, because he was also, we also wanted to address the weight loss as well. And then, yeah, just encourage him with the lifestyle changes, and of course, encouraging with the avoiding, well, he is already not doing alcohol, but just kind of encourage him to avoid all those exacerbating factors. So, yeah, that's my plan right there.
Sounds good. And Miss Alyssa.
All right, so I have not seen him yet. I'm planning on seeing him in a week. I think he has a day off coming up. So he's going to come into the office. I have like 5 key points I want to discuss with him. His lack of health insurance and getting him involved in the community health services. I know with your clinic, just reaching out and making sure he's getting everything that he needs there. determining his income, as well as seeing governmental services that he could be qualifying for, like food stamps, especially to improve his budget with his food, hopefully get the stress down with his medication costs, as well as I know he's a nicotine dependent, he's a smoker. So if we can cut him down on smoking, that'll save money in his budget there, as well as finding ways to get him involved so he's not so, I guess, lonely, so he has more people in the area. So getting him involved in church, in different, identifying his hobbies to get him involved in some groups, weight loss support group, because I know he needs to lose weight, as well as some free exercise classes that I know of. I also want to see how he's doing emotionally, mentally, because I know how taxing these diagnoses can be. See kind of where I can identify some stressors to address to make sure that he's doing okay mentally. I also want to identify his relationships, both local and with his sister. I know his sister lives in Montana. So we can further develop relationships so he has more people to depend on, and so he feels a sense of community here. So yeah, I want to identify those 5 points to hopefully get him happy and keep him that way.
Could we implement some of the shopping and food planning maybe with that, like getting him involved in community too?
Oh yeah, no, of course, yeah. So I also want to discuss with you some food costs, because I know you're creating the meal plan. So after you meet with him, I'm going to give you a call so we can kind of figure out where his budget is, see how we can figure out a good meal plan that will fit his lifestyle, because I know he does have a smaller budget.
Awesome. So we'll just follow up with each other and then we'll contact you, Dr. Horn.
Yeah, and Alyssa, if you do find, some governmental program that could potentially have his insulin covered, if that's a possibility, because he is in need for insulin, obviously he can't afford it, then let me know as well.
Yeah, no, of course I can handle that. I will start looking. Just send me over like dosages and like different brands, and then I can start looking into programs there. I know Dr. Chuck, you can also get involved with that with pharmacy costs. So yeah, we can all just coordinate hopefully to get him on insulin as you want.
Sounds good. Does anybody have anything else to say? All right, so as mentioned, I'll be seeing him once a month until it's controlled. Make sure to just send me any changes in anything that you guys come into terms with, send that my way. Obviously, some Dr. Rhodes, you won't be seeing him very frequently. But yeah, just let me know with any changes. All right, guys, have a good day.